Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. I'm very excited to welcome back on the show Dr. Raymond Niaura, Interim Chair of the Department of Epidemiology and Professor of Social and Behavioral Sciences at the NYU School of Global Public Health. Dr. Noyora is a longtime tobacco researcher of much esteem. He was the Director of Science and Training at the Schroeder Institute for Tobacco Research and Policy Studies at the Truth Initiative, and he is past president of the Society for Nicotine and Tobacco Research. Dr. Neora, thanks for coming back on RegWatch.
Great to see you again, Brent.
Now, for those who don't know, I think it's fair to say that NYU School of Global Public Health is providing some of the best research on issues concerning nicotine vaping products. Tell us about the school, the team, and the research.
Sure. So I joined NYU about 4 years ago. And at the time, it was a relatively new school of global public health. It still is, kind of new, but we've made great strides in terms of our, student enrollment and interest and so forth. And it's just great being at NYU. It's a wide bench. It's a deep bench. A lot of smart people here, which makes what I do look easy, and I thank them a lot. But yeah, it's just a great environment to be an academic, but also to be in a place where, we can work on things that are important to us.
Now, it seems that there's a liked mind, for the lack of a better term, with regard to safer nicotine products, where I say on the West Coast, there is at least one or two organizations that may not necessarily be so amenable to tobacco harm reduction. What can you say about that?
Well, there are always, differences of opinion, but it does seem that there has been this kind of bi-coastal split. But, hey, listen, people move around, things change. Some of the folks on the West Coast who will go unnamed, have retired. There are other changes in leadership going on. So let's just say, tomorrow is another day, and we may bridge the divide between the coasts.
So let's jump into, obviously, the issues we cover here. Why is the debate over nicotine vaping so contentious?
I think because it's very threatening to many people. It's and we can go through the whole list of reasons why, but I think it basically comes down to the whole idea, the whole concept, the whole reality of vaping and reduced, risk nicotine products is just, very threatening to people's world order, or sense of world order. And when people get threatened, they dig in, they lash out. And, that's what we've been seeing.
Why do you think, well, at least in our opinion, that the science seems so lopsided on this issue?
The science is lopsided, but I don't think it's as lopsided as it used to be. We still get a lot of really bad stuff being put out there. But at the same time, there are better and better pieces of science being reported on and published. As to the bad science side of things, there's been a lot more effort to kind of correct the record, to hold people to account. So I guess it can still seem lopsided, but from my point of view, we're catching up with the better science.
Now, one of the things that I'm hoping that we can tease out here over this show is whether or not you feel that there might be some progress being made with regard to cracking through on this issue in terms of acceptance of safer nicotine products. Where are we at? And just kind of maybe frame our conversation for us.
So I think where we're at is, the side that feels threatened, it has been pushing for restrictions. Flavor bans is probably the best example. But these restrictions, I think, are a prelude to trying to ban these products outright and, ban them from the marketplace 100%. That's my sense. That's my point of view. So, we have to ask, well, we can see this happening before our eyes. I mean, and Canada is a funny example, right? And you know better than I do, but it's kind of like, well, Canada seemed to be going in a pretty good direction. And then what happened? Why is there all this pushback on nicotine levels and flavors? And I'm still trying to figure out what happened. And I've been talking to a lot of colleagues who happen to be Canadian, and maybe you can tell me, Brent. But so in a sense, what's happening in Canada is similar to what's happening in a lot of other places. But why the turnaround? Why, what happened to, the leadership, the bureaucrats, the functionaries that were pretty much on board with tobacco harm reduction and now seem to be, going in the other direction?
Let's start back to when you were on the show with 2018. Walk us through those 3 years of youth vaping numbers. Was there an epidemic?
Well, I think I mentioned this last time I was on the show, but it's like, who defines what an epidemic is, right? And actually, there are no really hard and fast rules when it comes to, non-infectious diseases or behaviors or whatever. So it was really, a combination of Scott Gottlieb, who was then the commissioner of the FDA, and then the CDC, who basically said, look, there's an epidemic. And so the cat was out of the bag when that happened. And whether or not you agree that the numbers truly constitute an epidemic, that's kind of what we were stuck with. But to be fair, the numbers of youth who were, using products, certainly ever, but also more frequently, at least once a month or more, were elevated. And I get the concern and the focus, but then that just got completely blown out of proportion, both in terms of the gateway and all kinds of terrible bad things that'll happen to kids who use nicotine. And then, of course, around the fall of 2019 is when EVALI happened, which we now know had nothing to do with nicotine vapes. It was all, adulterated THC, vitamin E acetate, I believe. And that just, that was the extra firecracker in the fuel tank. That, and I think, those two things just supercharged the environment. And so you had, the U.S. that was in panic mode, or at least, a good segment of it. And then COVID happened, right? And so now we're all kind of like, well, where are we at?
I've got an article here that outlines the 2020 National Youth Tobacco Survey that indicates that teen use dropped by a third. And you were quoted actually in a news article from just a couple of weeks ago and said it dropped by 30%. So is youth use actually down 30% in 2020?
If we look at youth, and these are 12 to 18-year-olds, who use one or more times a month, the percentage is 19%. Okay, and I forget what it was back in 2018-19, but it was quite a bit higher. I think it was, closer to 30%. So that's a pretty substantial drop. Aside from e-cigarettes, everything is, pretty darn low. When you're under the 5% threshold, I don't know if people remember, but there used to be these, public health goals National Cancer Institute would put them out. The Centers for Disease Control and Prevention would put them out, and we'd say, we want to get to, 15% in 5 years or 10 years, 10%. And a lot of those, pronouncements basically said, when we get to, 5% and lower, it's not that we've licked the problem, but it's, then we'll know that we've made significant progress. So aside from e-cigarettes, every other category of tobacco product use is now below 5%, which is, hey, that's good news.
So doesn't that give some justification to the prohibitionists who want to then now, focus on eradicating vaping then?
Well, yes, there is that side of it. But then what argument do you have? So first of all, vaping is also going down. Second of all, this data, does not support the idea that there's a gateway, because if people are vaping and becoming smokers, we'd see those numbers, shoot up dramatically. And they haven't. They've continued to go down. So, where are you left with that? Well, it bothers me that kids are using, nicotine, which is a drug. Fair point. Okay, but, what do we do about it? Well, their response is, well, we should ban it. Okay. And then we come back to the argument, who are really using these products? It's adult smokers and former smokers. So then if we ban it, what's going to happen? And unfortunately, we're seeing some, recent data suggesting, where there have been severe restrictions placed on, e-cigarettes, flavor bans, and that sort of thing. The smoking rates are going back up. And so, is this what the tobacco control community wants? And it would be okay as long as we, dropped youth use down to, zero. And that's the dilemma.
It's a bit perplexing. Let me show you. I've just thrown up on the screen in Nicotine and Tobacco Research, an article, Reactions to Sales Restrictions on Flavored Vape Products or All Vape Products Among Young Adults in the U.S. And this was just published at the end of July. And basically it says that they've looked at the 2020 data that we've just been talking about, and they examined support for e-cigarette sales restrictions among e-cigarette users, perceived impact of flavored vape product and all vape product sales restrictions on e-cigarette and e-cigarette use. The results, if vape product sales were restricted to tobacco flavors, 39% of users reported being likely to continue using e-cigarettes, but over 30%, 33.2%, said they were likely to switch back to smoking.
Right. So isn't that concerning? It is to me.
Yeah. How is it that the nonprofit health groups and public health and so forth can just ignore that kind of information?
Well, because again, it does not fit with their narrative. They're single-minded. There's a single focus, has to do with youth, and anything else that comes into the discussion is discarded, pushed aside. Ideally, from their point of view, it's discredited, right? All that stuff that they call science is garbage, because the people that are writing these papers are in cahoots with the tobacco industry, and et cetera, and ad hominem attacks on people's character and et cetera. So and I've experienced some of that recently, and I know people who've really bore the brunt of those sorts of things, but that's what's happening. So it's an utter, disregard for facts. It's an utter unwillingness to engage in an honest discussion It's smear tactics. And, you can go on down the line.
Is it true to say that in the U.S., when we're talking about research here, that there really actually is a lot of new stuff coming out that seems to be hopeful for those that are on the pro vaping side? You would look at Abigail Friedman out of Yale with some very important work on flavors, showing that the flavor ban in San Francisco had a deleterious effect, and it did lead to some people going back to smoking, some youth to go back to smoking. So, I mean, is that your impression too as well, that the outlook and perspective might be changing in the U.S.?
It's hard to make sort of a blanket assessment, but I do agree that, there are enough people out there, and thankfully enough, younger scientists who are coming to this set of issues with more of an open mind, and which is good, because you need to be open-minded, when you're a scientist. But also, it's a bit of a counter reaction to what they've seen going on. These knockdown, drag out, arguments and taking sides. And if you're a good scientist, you're going to say, wait a second here. Why is there such passion? I want to take a look. And I want to use, my methods, what I've learned, how to do science, to take a look at this myself. And the more people do that, I think the better off we all are. Because then we're working from the same, hymn sheet. The music is all there for everyone to see. And then if it comes down to, matters of interpretation and so forth, at least we can be honest about that, and we can be honest about our biases and uncertainties. And that's uncertainty. People have trouble with uncertainty in all areas of life, right? But the issue with science is that's what science is about, is you're dealing with uncertainty like 99.9% of the time. And you got to get used to living in that environment. And some people just don't do uncertainty very well.
Dr. Niaura, we just had Clifford Douglas on the show. He's an adjunct professor at the University of Michigan School of Public Health and former vice president of tobacco control at the American Cancer Society. So he knows where the bodies are buried in tobacco control, so to speak. And he's very strongly has come out and said and called for a ceasefire inside the tobacco control community, because there's so many shots going on with regards to vaping. What are your thoughts on that issue?
Well, I know Cliff pretty well. And, he's an example of someone, and he's not the only one, but he's a pretty prominent example of someone who, was looking at this debate over time, in the context of working for the, American Cancer Society. And I believe he became interested in, the back and forth, and started paying more attention to what the science is telling us and not telling us, right? We get back to uncertainty. And I think he came around and said, there's more to this than, than the one-liners and the zingers and the threats and recriminations. That, there's something important going on here. There's and sometimes a complicated and nuanced story. And it's important because it involves, lives, saving lives. And, if we can figure this out and get it right, maybe we can make some real advances beyond, whatever tobacco control has been doing successfully, for the past, 2-3 decades. So yeah, I think Cliff basically said, listen, first of all, we can't have an honest discussion if everyone's sniping at each other. And that, that's the call for the ceasefire. So which is welcome. I mean, we need to be able to engage in dialogue. That doesn't mean you can't have strong feelings about certain issues, but to be able to, at least entertain the possibility that you're not right or not 100% right on all the issues is an important, first step to getting to the place where you can have that honest discussion.
Whenever, say, like the Campaign for Tobacco-Free Kids or politicians talk about underage use of nicotine vaping products, it's always the children. They'll say the children, the children, the children. And when public health kind of vacillates, around their terms, they'll be youth, teens, or kids. Why so much variation, and is it a bit mendacious to say children?
Well, language is important, and the image of a child is one of beauty, fragility, vulnerabilities, someone that needs, protection. And that's what that language evokes. So it's entirely natural. Nobody's going to, make an argument about protecting children from anything, really. We often talk about paternalism, right? Well, this is paternalism at its root. And, that nobody has a problem with that kind of paternalism.
Is it fair, though, to be doing that? I mean, I know as a vapor, B, as a journalist covering this issue, and C, as somebody who watches the reactions of consumers out there that use vaping products, it's maddening to hear the discussion always about children and kids when adults are the ones that are intended to use this product, and they're the ones that actually their lives are being saved.
Well, unfortunately, adults do not garner the same amount of sympathy as young people do, children. You know how it goes. Once you pass a certain age threshold, and I'm not exactly sure when that is, get out of the house, get a job, look after yourself, and whatever happens to you is your own damn fault. So, but yeah, I agree, but this is the force of language, and it can be maddening, but realize that it's deliberate. This is by design to get people's attention and to rile people up.
It doesn't seem to be a fair use of science.
Well, this is where the scientists kind of have a quandary, because scientists like to be very careful in terms of the language that they use. They try to be consistent, and this is one of those areas where well, what do we do? Well, we call them children, kids, teens, etc. And I don't think scientists are particularly comfortable using that language, and they're always searching for kind of better ways to describe the populations that are being studied. So it's a challenge.
Let me ask you about FDA and the PMTA process. Deadlines coming up here in September, where it looks like, or at least it appears to be the case, that FDA will meet this deadline and authorize the use of at least a couple of vaping products. What's your understanding there?
Well, it's just over a month away, and I can look into my crystal ball, which won't do much good. But my best guess is, I don't know if they'll make announcements on all products on the 15th necessarily. I think they will probably announce more denials than they will approvals, which is nothing we should be, that shouldn't be unexpected just because of the vast number of applications that were submitted. I tend to agree that it's, my best guess is that they will approve at least, a few products. I don't know which those will be, though. And if that happens, that's going to change things in ways that we have yet to foresee, except for some things. So, for example, I predict that the ardent, strident tobacco control community will not say, aha, now we have some products that are, legally entering a regulated marketplace. I don't think they're going to give any ground. And they're still going to be going after these products and calling for their removal and their ban. And they're going to be working the political system just as hard, if not harder, than before. So that's we'll see if I'm right, but that's one prediction.
That particular prediction on your part, Dr. Noyora, is almost guaranteed, certainly by...
Yeah, that's a low bar. That's an easy one.
Yeah, I mean, but it's distressing. Well, why is it, do you think, that that's going to be the case, that they're going to double down? I mean, is that just the ferociousness that it comes with dogma and ideological battles?
Yeah, and also, they're part of a big machine in terms of funding and staff and everything. It takes a lot to keep that machine rolling, a lot of resources. And you can't shrink. You've got to keep growing. And I think that's a big part of it.
So, I mean, often we've said that there is a tobacco control industrial complex. I mean, there is a business, a full-on economy around it, and that vaping has always threatened that. Is that what you're saying?
In part, but the irony is that we'll take the case of vaping. It's also the gift that keeps on giving to them, because they always have the issue. So I wonder if they've thought through, well, what if we're successful and we get governments around the world to ban these products in their entirety? I wonder if they've asked themselves the question, well, what are we going to do then? So I mean, it's just this kind of interesting dynamic. And they're not very diversified, right? They talk about, tobacco products, and then, as use of conventional tobacco products starts to decline, they have less and less to talk about, but they use a bigger and bigger megaphone to talk about it.
Right. And they also export their position to other countries, which we've really seen that to be the case with Bloomberg Philanthropies and the work that Michael Bloomberg's organizations and money seems to be doing around the world.
Oh, completely. And, one could ask the rhetorical question, what would happen to all of what's going on out there with the, tobacco control industrial complex if, perchance, all of a sudden, Michael Bloomberg decided that his priorities lie elsewhere and the funding went away? It's an interesting counterfactual to contemplate.
Sure. But there'll always be the funding that comes from the tobacco industry in terms of the master settlement agreement and so forth.
Well, there will be those kinds of funds. But, at least in the U.S., the master settlement agreement is, pretty close to being spent out. So, I don't know. Are governments going to want to spend a lot of money on this, especially during COVID times or other pandemics? I've heard recently that, funding for, just regular public health initiatives has been dwindling because all the focus and money's going into dealing with the pandemic, and rightly so. So, again, is tobacco use going to be a priority program for governments, given everything else that's going on?
The World Health Organization, Dr. Neora, has come out and really doubled down on their position that nicotine vaping is harmful. You've had some reaction to that out there in the news media. Fill us in on your thoughts.
Well, first of all, it's no surprise because this is what the WHO has been saying and doing for a long time. I guess the question I would have is how much of tobacco control at the WHO level is actually funded by Mike Bloomberg. He's one of the WHO health ambassadors, isn't he?
That's correct.
And he's an avowed anti-vaping, advocate. So I just see it's hard to see the WHO as anything except extremely biased in their perspective and in everything that they put forth and communicate. I haven't seen anything in terms of honest, straightforward communication and process and discussion. To the contrary, it's all been a dismissal of quote unquote so-called scientists who have a different point of view. So you probably can tell that I'm not a big fan of the WHO, at least when it comes to tobacco.
Dr. Niaura, if FDA does authorize some vaping, some nicotine products for the protection that it's appropriate for the protection of public health, what would that do in terms of public perception around vaping? Do you think it would make a difference?
I think it should make a difference. How long it would take for that to happen is anybody's guess. So I think whatever the FDA does is still probably going to be drowned out, by the other side. And who knows, maybe, these tobacco control groups and concerns will start, will sue the FDA. They've already sued them a bunch of times. So what's to say that they won't, draw them into additional lawsuits and so forth. But one has to hope that the truth eventually will prevail. I think the real wild card, though, is not only what the FDA will communicate, if anything, but also what they will permit those companies who have approved products to say about their products, in terms of marketing and everything else. And that whole issue is very sticky. The FDA has been, traditionally very, conservative about this sort of thing. But that's not to stop, others, such as scientists or other people who are concerned with public health, from, basically telling the truth and saying, well, now these products have been approved. It's interesting if you look at the two, products that have been approved so far. So you've got Swedish snus, and then you have the heat not burn, the IQOS product. And you don't hear a lot about those products. Every now and then you sort of do. But just lately, and there has been more of a focus on heat not burn, even though the use in the U.S. is extremely low because it's only marketed, I think, in 4 states or something like that, 4 cities really. But we're starting to hear, oh, what about youth using these products? And by the way, I mean, there's it's a minute. If there are any youth using these products, any children, it's got to be such a minuscule number. But they're starting the drumbeat, and so I think they're ready, to pounce on this whole issue of whatever happens with the FDA, they are already writing their playbook.
And just to your point, Dr. Noyora, there has been in the last several months, not a litany, but a drumbeat as well, as kind of use your term, saying, as pandemic nears end, teen vaping threat resumes. And it's like CNN has had that. We've seen some stuff in the New York Times, which is just basically that, okay, well, the pandemic may have caused a drop in teen vaping. Now that people in life is getting back to normal, get ready for, a major increase. And so they've kind of spun back up the machine.
Yeah, and isn't that highly irresponsible journalism? Because we don't have any data that the rates are going back up. So this is all make-believe. It's like, well, we have to get ready for a crisis. Excuse me. And by the way, no, the pandemic isn't done yet. It's got plenty of surprises in store for us. What about, and everything that goes with it, society's upheaval of society and unemployment and on and on and on. So this is very pernicious okay, where are these journalists, so-called, getting their stories, right? Is this something that they're just saying, I think I'm going to write about this today because it's interesting? I highly doubt that that's the case. I bet you they're being fed propaganda, to gin up the outrage machine.
Well, there's no doubt about that, because clearly they've got the same message here, CNN, and this is July 14th, 2021. So just a month ago, vaping debate heating up once again. It was a pivotal public health crisis in America before the COVID-19 pandemic, and then we stopped talking about it.
Well, and it gets back to my point that, the tobacco control industrial complex, I'm going to use your term, I do like it, needs fuel to keep running. And they have to generate their own fuel. But it's unfortunate that, the journalistic world, runs with this sort of stuff. But, I guess that's also not too surprising, in this day and age of instant and ubiquitous communication. Everybody needs a job, I suppose.
True. And that is that fear appeal that you had discussed on your last appearance on our show. I just loved how you put this, Dr. Noyora. They are a perpetual motion machine. They defy the laws of physics. They create their own momentum.
Oh, yeah, very much so. And they've learned all the lessons of public relations, how to do this, how to play politics, et cetera, et cetera. It really is a well-oiled machine. And also, again, I think a lot of the timing is related to the September, 9th deadline for the FDA. And, we've seen this kind of slow ramping up. And then I predict September 9th comes around, we're going to see the uproar, we'll be deluged. Okay, it's good news. We're seeing a decline. Now, it's fair to ask, well, is it a pandemic effect? Or is it one of these things that, this is just starting to run its course in terms of, novelty and youth behavior and rebelliousness and, all that stuff. And kids are just saying, we'll move on to the next thing. I think it's also interesting that, alcohol use remains elevated. I don't think that showed much of a drop at all in terms of the pandemic effect. And also in this NYTS data, there was one question on vaping cannabis or marijuana, THC, hash, and it's an ever question. Have you ever vaped? So it's not smoked, it's not used, it's specifically vaped. And a huge number of kids say yes, way more than use e-cigarettes. So this, raises the question for me, whatever's happening with using e-cigarettes is not a one-off behavior. It's in the context of a whole bunch of other things, that are going on, and in particular vaping cannabis. Now, where's that going to go, right? And how is that going to relate to anything else? And oh, by the way, if I were a parent, I wouldn't freak out, but I'd be a little bit more concerned about my teens vaping cannabis than I would be about them vaping nicotine. Not that I want them to do either, but I'd probably have a conversation with them faster if I knew they were vaping cannabis than nicotine. So it, and again, this gets back to the uncertainty. There's just a whole lot going on with youth, with kids, with children, that, some people pretend that they know, they know the youth mind and they know what's going on. And I think that's just hogwash. And again, vaping rates at 19%. Sure, let's keep an eye on that. But what about all this other stuff that's going on? And why is this happening? And again, post-pandemic, whenever that's going to be, we don't know what's going to happen.